Hey guys, welcome to the first video of the basic elbow series where we'll go over some of the basic bony landmarks and joints of the elbow in this video. So the three major bones are the humerus, if we're looking at the right side, the radius, and the ulna. The radius starts off smaller at the elbow and then becomes larger at the wrist. And on the opposite side, the ulna is larger at the elbow, which we'll be looking at today, and is smaller at the wrist. So if we zoom in, looking at the distal part of the humerus first, you have the lateral and medial epicondyles. So the epicondyles are the part of the bone that kind of flares out. And the protrusion right here is called the capitulum. And on the ulnar side is the trochlea. So you have the lateral epicondyle, the medial epicondyle, the capitulum, and the trochlea. This little divot where it kind of the bone kind of caves in, that's a fossa, and that is the radial fossa, because when you bend the elbow, the radius is going to fit right in there. And this fossa is the coronoid fossa because you have the coronoid process of the ulnar bone right there. So distally, you have the lateral and medial epicondyle, the trochlea, the capitulum, the radial fossa, and the coronoid fossa. Let's take a look on the posterior side of the humerus. And you have underneath the olecranon process, that bony part of the elbow is the olecranon fossa on the humerus. So the olecranon process is part of the ulnar. And going back to the front side, we already looked at the coronoid process. And then the ulnar side also has the radial notch where the radial head attaches. So the radial head is part of the radius, and then you also have the radial tuberosity. It's also known as the bicipital tuberosity, this little tip right there of the radial bone. And the radial or bicipital tuberosity is where the biceps will attach. So you have the radial head, the radial tuberosity, the radial notch on the ulnar bone, the coronoid process, and on the backside, the olecranon process. So those are the bones of the elbow, and they're pretty simple. With the joints, you only have three joints. You have the humeral radial joint, which is smaller than the humeral ulnar joint because the ulnar bone is larger. And then you have the radial and ulnar joint, the proximal radial ulnar joint. The distal radial ulnar joint is going to be at the wrist. So the humeral radial joint, the humeral ulnar joint, both do flexion and extension of the elbow. And then the proximal radial ulnar joint is the joint that does pronation and supination. So the motion where you rotate your hand up and down, where you flip your hand backside down. So that's it for the bones and joints of the elbow. Stay tuned for the next video where we'll be going over the muscles of the elbow joint. Make sure you guys like and subscribe to Sports Science Student if you guys haven't done so already, and I'll see you guys in the next video.